Hi everyone, welcome to this week's episode of Skin Talk by Dr. Naidu. In today's episode, we'll be talking about a topic that most of you have been stressed out about: hair fall. Whether it's thinning of hair, excessive hair shedding, or baldness. I'm here to answer all of your questions. In today's episode, I'll be answering few of your questions and also giving some tips to keep your hair all healthy and happy. Let's start. Okay, so a lot of you have asked me how to stop hair fall. Well, the thing is, hair fall is totally normal. It's a part of your hair cycle. Losing up to 100 strands per day is okay. The problem is when it's more than that. So not expecting any hair fall, no, not realistic. Hair fall is normal and it happens to all of us. Few teenagers are asking about hair fall at the age of 16 to 17 years. Well, during this teenage, your body undergoes tons of hormonal changes and that shows up onto your skin and hair. And also your diet and stress could trigger this. So if you're having more hair fall than usual, it could be because of these reasons. So try eating well and also use gentle hair care products. Arman is asking about rosemary water for hair fall. This rosemary is all over the internet and all of this hype started post a study that used rosemary oil showed effective improvement in reducing the hair fall and also promoting new hair growth. In case you want to use this rosemary oil, take 5 to 10 drops, mix it with around 1 tablespoon of a carrier oil and massage it into your scalp. But be watchful for any allergic reactions. Hina is asking one interesting question. Without any blood test, how to know the reason for the hair loss? When it comes to hair loss, we mainly divide it into two categories. Category 1, your telogen effluvium. This is where there is increased hair shedding, which could be because of your hormonal changes, any nutritional deficiencies, stress factors, or recent illness. It is usually temporary and the hair grows back. Category 2, pattern baldness. It is genetics. So in family, if you have any history of thinning, this is what it could be because of. Now in case you do not have any family history of thinning, you are eating well, sleeping well, maintaining a healthy lifestyle, but still your hair fall is on, it could be a sign of your blood having vitamin deficiencies or thyroid imbalance. So it's always better to get it diagnosed with a simple test. Akansha wants to know how to get rid of split ends. Well, it's very simple. Just cut it. It hardly takes a minute. And for the future split ends not to develop, use a gentle shampoo, use a conditioner to keep your hair hydrated, and use a serum to lock in the moisture. Hulk wants to know what serums to be used for hair fall. For hair fall, you can use serums with ingredients like your peptides, Redensil, caffeine, biotin, and many more. These serums help strengthen and promote new hair growth. But in case of doubt, it's always better to consult a dermatologist. Rohini wants to know which shampoo to be used for hair fall. For hair fall, you can use a shampoo with caffeine because this caffeine increases the blood circulation. But honestly, shampoos alone do not do much. Given the contact period is so less, so it's always better to combine with other things like your tablets and hair serums. It's all about creating a routine that targets your hair from every angle. Usha is asking, I'm having hair fall and vitamin B12 deficiency, doc, what to be done? Well, it's pretty simple. Your hair fall is because of this vitamin B12 deficiency. Start taking the supplements and your hair fall will reduce too. Also, you can improvise your diet like your dairy, meat and egg, that will help. And that's a wrap for today's episode. And remember, things like your diet, supplements and little self-care goes a long way. Keep your scalp healthy and don't forget to show your hair some love. Thank you for tuning in and I'll be seeing you next time with some more interesting tips and answers to your questions. Take care.